I was in surgery when my colleague collapsed in the hallway just outside the operating room. 62 years old, brilliant cardiologist. His wife was standing 20 feet away and she froze. She didn't know what to do. He survived, but he lost 4 years of his memory. That image never left me, and it's why I made this video specifically for you. I'm a cardiothoracic surgeon with over 25 years in cardiovascular medicine. I've operated on hearts. I've held lives in my hands, literally. And I can tell you this with complete certainty. Stroke is one of the most preventable tragedies I've witnessed in my entire career. Not preventable in the sense that it never happens, but preventable in the sense that the damage doesn't have to be as bad as it so often is. Here's what most people don't know. Stroke is the 5th leading cause of death in the United States, and for adults over 60, it's one of the leading causes of permanent disability. Every year, nearly 800,000 Americans have a stroke. That's one person every 40 seconds. And roughly 2/3 of stroke survivors are left with some form of lasting impairment, difficulty walking, speaking, remembering. Those are frightening numbers. But here's what frightens me more as a physician. The average time between a person noticing their first symptom and actually calling for help is, are you ready? Over 30 minutes. 30 minutes. In stroke medicine, we have a saying, time is brain. Every minute without treatment, a person loses nearly 2 million neurons. 2 million. By the time 30 minutes have passed, that's 60 million brain cells gone. And why do people wait? I've asked hundreds of patients and families this exact question. I thought it would pass. I didn't want to make a fuss. I wasn't sure if it was serious. I didn't want to call an ambulance and be wrong. I understand that, especially for people of your generation, people who were raised to be self-sufficient, not to burden others. I deeply respect that. But stroke is the one situation where waiting is the most dangerous thing you can do. So today, I want to give you something practical, something you can remember, something that takes 3 minutes to learn and could save your brain or the brain of someone you love. Let me explain something that changed the way I think about stroke, and I believe it would change the way you think about it too. When a stroke happens, a blood vessel in the brain either bursts or gets blocked. Blood stops flowing to part of the brain, and brain tissue, unlike muscle, unlike skin, does not recover well from oxygen deprivation. It starts dying within minutes. But here's the part that gives me hope. Right around the damaged area, there's a zone we call the penumbra. Think of it like the edge of a fire. The center is already burning, but the edges, they're still salvageable. Those cells are injured, stunned, struggling, but they're alive. And if blood flow is restored quickly enough, many of them survive. That's the brain you get to keep. The penumbra can survive for roughly 3 to 4 hours in some cases, but the sooner you act, the more of it you save. Every minute of delay shrinks that salvageable zone. That's not poetry, that's neuroscience. So when I say 3 minutes matter, I mean the 3 minutes you spend recognizing what's happening and calling for help. Not 3 minutes of treatment, 3 minutes of decision. That decision is what opens the door to treatment. Treatment that can dissolve a clot, restore blood flow, and preserve your function. You are not overreacting, you are protecting your brain. You may have heard of FAST. It stands for face drooping, arm weakness, speech difficulty, time to call. It's a good system, but in my experience working with older patients, it's not complete enough. Because stroke in people over 60 can look different, and I don't want you to miss it. So let me give you the expanded version. I call it B FAST. The B stands for balance. A sudden loss of balance, feeling like the floor tilted, like your legs stopped cooperating. That can be stroke, not dizziness from standing up too fast, but a sudden, unexplained loss of coordination. The E stands for eyes. Sudden blurred vision, double vision, or losing sight in one eye, even briefly. That's a red flag. People often dismiss this. It passed in a few seconds. Yes, and that passing episode may have been a mini-stroke warning you, a warning that a bigger one is coming. Then comes fast as you know it. Face. Ask the person to smile. Does one side droop? Arm. Ask them to raise both arms. Does one drift downward? Speech. Ask them to repeat a simple sentence. Is it slurred, strange, or suddenly impossible? And here's one more that doesn't fit the acronym but matters enormously for older adults. A sudden severe headache. Not your usual headache, a headache that feels like something exploded inside your head. That can signal a hemorrhagic stroke, a burst blood vessel. Do not lie down and hope it passes. Can I ask you something? If you felt any one of these symptoms right now, just one, would you call immediately, or would you wait 10 minutes to see if it gets better? I genuinely want you to think about that answer, because your honest answer tells you what you need to work on today. All right, you've recognized the symptoms, you've made the call, or someone has made it for you. Now, what do you actually do with your body while you wait for the ambulance? This part matters more than most people realize, and there are some things people do instinctively that can actually make things worse. First, sit or lie down carefully. Do not stay standing. If you feel unsteady, lower yourself to the floor if you must. A fall during a stroke causes injuries on top of a medical emergency, and that complicates everything. Second, position matters. If you are conscious and breathing normally, sit upright or lie on your side, not flat on your back, on your side. This is important because stroke can sometimes affect swallowing. Lying flat on your back increases the risk of choking. Think of it as the recovery position, on your side, knees slightly bent, head supported. Third, and this is critical, do not eat or drink anything. Not water, not your morning medication, nothing. I know that sounds strange, but stroke can impair the swallowing reflex without you realizing it. What feels like a normal sip of water can go directly into your lungs. Wait for the paramedics. Now the medication question. I get asked this constantly. Should I take an aspirin? Here is my honest answer as a physician. Do not take aspirin unless a dispatcher or doctor tells you to. Why? Because not all strokes are caused by clots. Some are caused by bleeding in the brain. If you take aspirin during a hemorrhagic stroke, you make the bleeding worse. The paramedics need to determine which type of stroke you're having before any medication is given. And finally, stay as calm as you can. I know that's easier said than done, but elevated blood pressure from panic can worsen a stroke in progress. Slow, steady breathing, in through the nose, out through the mouth. Focus on that until help arrives. Let's talk about the phone call itself, because how you make that call, what you say in the first 15 seconds, directly affects how quickly you receive care. Call emergency services immediately. In the US, that's 911. In the UK, it's 999. Do not call your family doctor first. Do not drive yourself to the hospital. Call emergency services. Ambulances carry clot-dissolving medication and stroke protocols. Your car does not. When the dispatcher answers, say these words clearly. I think I'm having a stroke, or I think this person is having a stroke. Those specific words activate a stroke protocol in most emergency systems. The response changes. The right team gets mobilized. Then give your address. Speak slowly. Repeat it if asked. If you're confused, and confusion is a stroke symptom, so don't be ashamed if this happens, try to describe where you are. Near a landmark, a cross street, anything recognizable. Here is something most people don't know. Stay on the line. Do not hang up after giving your address. The dispatcher is trained to keep you calm and monitor your condition. They are your lifeline. Let them talk to you. Even if you can't respond clearly, leave the line open. One more thing. If you live alone, and many of my patients do, unlock your front door before you sit or lie down. Paramedics lose precious minutes when they can't get through a locked door. If you can safely reach the door, unlock it, then position yourself and wait. Do you have a neighbor you trust? Someone whose number is saved in your phone right now? If the answer is no, I want you to think about changing that after this video. A trusted neighbor who can be called in 30 seconds is one of the most powerful stroke survival tools you have. Now, I want to speak directly to those of you who live alone, because the protocol shifts slightly, and you need to know this. If you're by yourself and symptoms begin, your first move is the phone call, not the door, not telling someone, the call. Do it immediately before anything else because your window of clarity may be short. Stroke can progress quickly, and you want that call made while you can still speak. After the call, unlock the front door. Come back and position yourself safely near it if you can, somewhere visible. If you have a medical alert device, use it. That's exactly what it's for. And if you've been putting off getting one, for adults living alone over 60, a medical alert device is not a luxury. It is a genuine, life-saving tool. One last thing for those living alone. If you lose the ability to speak before you finish the call, don't hang up. Leave the line open. Dispatchers are trained to send help to an open, silent line. Your silence tells them something is wrong. Stay on. I want to address something that I believe costs more lives than almost any other factor in stroke care, and that's the decision to wait. I had a patient, a retired school teacher, 68 years old, sharp as a tack. She woke up one morning and noticed her right hand felt strange, weak, a little numb. She thought she slept on it awkwardly. She made breakfast. She read the paper. She called her daughter, not to say something was wrong, just to chat. An hour and 40 minutes passed. By the time she arrived at the hospital, the treatment window for clot-dissolving medication had nearly closed. She recovered partially, but she never regained full use of that hand. She told me later, "I just didn't want to be dramatic." Those words have stayed with me ever since. Here's what I need you to understand. With stroke, there is no such thing as being dramatic. There is only acting or not acting, and the cost of not acting is measured in brain cells, millions of them that don't come back. A mini-stroke, what we call a TIA or transient ischemic attack, often produces symptoms that disappear within minutes. People feel fine afterward and conclude it was nothing. But a TIA is your brain's loudest warning signal. Nearly 1 in 5 people who have a TIA will have a full stroke within the next 2 days. 2 days. If symptoms disappear, you still call, you still go, you still get checked. The ambulance is on its way. You've done the right thing. Now your job is simple, but important. Stay awake. I know that sounds obvious, but a stroke can make you feel an overwhelming urge to sleep. Fight it. Talk out loud if you need to. Count slowly. Describe the room around you. Keeping your brain engaged and your consciousness active is meaningful during these minutes. If someone is with you, ask them to keep talking to you. Keep responding, even if it's just a nod. Breathe deliberately. In through your nose for 4 counts, out through your mouth for 4 counts. This is not just relaxation advice. Controlled breathing helps maintain oxygen levels and keeps blood pressure from spiking further. It gives your brain the best possible conditions while you wait. Do not let anyone move you unnecessarily. Well-meaning family members sometimes want to lift you, carry you to the car, rush you themselves. Ask them to wait for the paramedics. Moving a stroke patient incorrectly can cause additional harm. The ambulance team knows exactly how to do this safely. And finally, if someone is with you, ask them to write down the time symptoms started. That single piece of information, the exact time, is one of the most important things the medical team will ask when you arrive. It determines which treatments are available to you. If you're alone, look at a clock and say the time out loud. That timestamp could change your outcome. Here is what I want you to truly understand, not as a surgeon presenting data, but as a human being who has watched too many people lose too much. The brain you have right now, your memories, your personality, your ability to recognize the faces of people you love, that brain is not guaranteed. It is fragile, and it depends more than almost anything else on what you do in the minutes before medical help arrives. We have treatments today that were unimaginable 20 years ago. Clot-dissolving drugs that can restore blood flow within hours, surgical procedures that can physically remove a blockage from inside a vessel, stroke units staffed around the clock with specialists who do nothing but this. The medicine is ready. The technology is ready. The question, the only question, is whether you get there in time for it to work. And that window, that precious, irreplaceable window, it doesn't open at the hospital. It opens the moment you recognize something is wrong and pick up the phone. I've seen patients walk out of stroke units with almost no lasting damage because someone acted within minutes. I've also sat with families in quiet rooms and explained why their loved one would never be the same because an hour was lost to hesitation. You now know what they didn't know. You know be fast. You know the right position. You know what not to take. You know what to say when you call. You know to unlock the door. You know to note the time. That knowledge is not small. That knowledge is the difference. And you have it now, right now, today. Let's bring it all together. Here is what we covered today. 1. Time is brain. Every minute of delay costs you millions of neurons. The 3-minute decision to act is the most powerful thing you can do. 2. Know be fast. Balance, eyes, face, arms, speech, time, and add the thunderclap headache. If you notice any one of these, any single one, you call immediately. 3. Position yourself safely on your side. Unlock your front door and do not eat, drink, or take medication until paramedics arrive. 4. When you call, say the words, "I think I'm having a stroke." Stay on the line. Note the time symptoms began. That timestamp is medicine. 5. If you live alone, make 2 decisions today. Save a trusted neighbor's number in your phone and seriously consider a medical alert device. Now I have a question for you, and I genuinely love to see your answer in the comments below. Did you know the Be Fast protocol before today? Because in my experience, most people haven't heard of it, and I think that needs to change. If this video gave you something useful, something you'll actually remember, please share it with your spouse, your adult children, your neighbor. You may not know whose life you're saving when you hit that share button, but statistically, someone in your circle needs this information right now. And if you haven't subscribed yet, please do. Every week I bring you exactly this kind of practical, honest medical guidance. No confusion, no fear, just knowledge that works. I'll leave you with this. You are not powerless in the face of stroke. You never were. You just needed the information. Now you have it. Use it. And remember, everything I've shared today is general medical information based on current guidelines. Every person's situation is unique. Nothing here replaces the guidance of your own physician. Please talk to your doctor about your personal risk factors.